Hello, we are Doctorate of Physical Therapy students from Franklin Pierce University. Today we're going to show you 8 effective flexibility and mobility exercises to alleviate the symptoms of osteoarthritis. According to the Centers for Disease Control, osteoarthritis is considered a normal part of the aging process and will generally present during the 5th or 6th decade of life. About 65% of all adults over 65 years old will have a diagnosis of osteoarthritis. The goal of this video is to provide a protocol for a quick, easy to do, at-home flexibility and mobility exercise program to decrease the pain and stiffness associated with osteoarthritis. Large joints such as the low back, hip, and knees are going to be mostly affected. This video will focus on flexibility and strengthening of these body parts. As with all exercise programs, please consult your primary medical professional before initiating exercise. Each exercise should be done to your own comfort level and tolerance. It should elicit a slight tightness or pulling on the targeted muscle. If you feel pain or discomfort of any kind, please discontinue the painful exercise. Thank you.
So the first exercise that we're going to do today is a double bent knee fall out. I'm going to have my patient here, I'm going to have him bring his knees up so that his feet are flat on the table. And then I'm going to ask him just to gently to control his legs down to the sides so that he feels a stretch on the insides of his thighs. I'll let him hold that there for 15 to 20 seconds. And then I'll have him bring his legs back together, rest, and then he can repeat that 2 to 3 times. The second exercise we're going to talk about today is a double knee to chest. It's a gentle range of motion exercise and stretch for the low back, the buttocks, and the back of the thigh. You have your patient lying flat on the table. You have them bring both knees up to the chest and pull with their forearms. You're going to feel the gentle stretch, like I said, through the low back of the buttocks and the back of the legs. We'll have him hold that for 15 to 20 seconds, and then I'll have him rest, put his feet back on the table, and he can repeat that 2 to 3 times to his own comfort. If this is too difficult or painful, then you can have him do a single knee to chest, where he only brings one foot up at a time, and he's just working on the single leg that he's bringing. This one remains down, and you will alternate back and forth. Still doing 15 to 20 seconds. Still doing 2 to 3 sets per side. You'll be working on each side independently. The third exercise we're going to talk about is the lateral trunk rotation. It's to help you get a little motion in your lower back. So you have your patient lying here, bringing both feet up so that their feet are flat on the table, and you'll have them. You also have to make sure that their shoulders are flat and their shoulders stay flat on the table the entire time. So you'll have them rotate their legs out to the side so they feel a gentle stretch along the low back here. Hold it for 5 seconds, and they'll come back to midline and go to the other side so they feel a stretch along the other side of the low back. You hold 5 seconds each side. I want you to perform 5 times for 5 seconds. Now we're going to demonstrate a strengthening exercise. It's called the glute bridge. You're going to have your patient bring their knees up so their feet are flat on the table. You're going to put their arms flat on the table as well. You're going to stabilize through the forearms, the upper back, and the shoulders. And you're going to have the patient squeeze their buttocks and bring the hips up to the ceiling. Ideally, we want you to perform at least 10 of these. You'll gradually lower yourself back down, rest as needed. So we'll do that 10 times. And as you increase your strength, you can possibly perform 2 to 3 sets of that. Now we'll be performing a stretch for the back of your leg. What I want you to do initially is scoot to the edge of the chair or table that you're using. I want you to sit on the sit bones of your bottom at the very edge. I want you to stick one foot out so that your heel is the only thing contacting the floor. I want you to make sure that you maintain a very straight low back here. I want you to look straight ahead. Bring your toes up towards your knee. I want you just to gently hinge forward at the pelvis, keeping your back straight. You should start to feel a gentle stretch in the back of the knee and the whole back of the leg there. You hold that for 15 to 20 seconds, and then you relax. Okay? And we'll perform 2 to 3 sets on this leg, and then you will alternate. You'll come over to the other side, same thing. Keep the back straight, foot out, toes up, and hinging forward at the hips. 15 to 20 seconds there, 2 to 3 reps. Now we're going to work on stretching the lower leg here and on the back side of the lower leg. I want you to face a wall. I want you to place both forearms against the wall, lean into your forearms, keep your head looking at the wall, and bring one foot back, keeping the toes and heels in line facing the wall, and keeping the heel down. You're going to start to feel a gentle stretch in the whole back of your leg here. Hold this for 15 to 20 seconds. Perform it 2 to 3 times to your own comfort, and then alternate to the other leg. Alright, now we're going to perform a strengthening exercise for the lower legs. We're going to hold on to the wall, face the wall, just hold on for your own stability. We're going to do heel raises here. We're going to come up gradually onto your toes, lower yourself down gradually. We're going to perform 10 reps. We're going to do 2 to 3 sets to your own comfort, resting as needed in between. Now we're going to perform the mini squat. It's going to strengthen those lower extremities, your buttocks, your thighs, and your lower legs. I want you to find a table, a chair, a counter, something very sturdy that you can hold on to without it tipping. I want you to step up close to it, hold on, put your feet shoulder width apart, stand fully erect, eyes facing forward. Then I want you to descend halfway to a seated position. So like you're sitting in a chair, but only go halfway down and then come up. I want you to perform 10 reps of this.